Hi guys, Dr. Amy here. In the last video, we talked about more in depth about the trajectory of brain development. Now, we all know at this point that the brain develops in a very specific way. We went through in the last video lesson about how as we move through development, we acquire different skills and become more sophisticated in using those skills to process our world. In this video, I want to talk about a few examples of what does it look like if we don't move through development in that really efficient way. What are some things or what are some behaviors that may manifest as a result of having some gaps or some alterations in the way the brain has moved through development? So we understand that we move through that bottom up, back to front, inside out, right to left development. We understand that primitive reflexes, movement, touch, auditory, verbal, and visual cognition or visualization is the way or the tools that we go through. Now, if we have a child that for some reason has been hindered, maybe because of a stress response, maybe because of a stress response that's not even there anymore, or maybe it was a short term, maybe it's a stress response that is still there. This is where your Focus Academy doctors come in. They're trained to assess that and to do their work to till the soil to get the brain out of stress. Now, if we have a child or a participant, could be an adult even, that has some gaps that lead them to, let's say, being they have more eggs in their processing basket or more sophistication in their ability to use movement touch, let's say. So one of their primary skills is to move their body and touch things, and that's one of the primary ways that they process their world. And maybe they have some primitive reflexes still, and they might have some visualization ability or executive function ability and some auditory verbal. But let's say one of their primary ways, because this trajectory of brain development has been altered, let's say that one of their very primary tools that they've learned to process their world through is through moving their body and touching things. What do you think this individual is going to do most of the time? That's right, you should have said it. They're going to move their body and touch things. And what does that look like? That may create a behavior that looks like a hyperactive, right, impulsive child or adult who needs to move their body and touch things or move their body in order to process. Now, what do you think is going to happen when we put that individual in a setting or an environment that creates more stress for them, whether it's an academic environment or a social environment or a working environment? Stress goes up, demand of processing goes up. Their primary tool of processing is their most sophisticated tool is moving their body and touching things. What do you think they're going to do? They'll probably increase their movement and touch, which would be a perfect behavior. It would be a perfect behavior for how their brain is processing their environment. What we need to understand is we don't want to just shut that down. We want to understand it. We want to understand that behavior is in fact a window into the brain, and we need to know that that might just be telling us a lot about how they're processing their world. So in the same sense, on the educational approach and the clinical approach, your Focus Academy doctors should be tilling the soil to get the brain out of stress. And the educational side is we want to go back and we want to specifically exercise the brain in specific ways to help them be more sophisticated and develop sharper tools to process their world so that they don't need to engage in such movement touch.